All right, everybody, welcome back. We have our Friday review here today on the show, always bringing you a quick tip or book review, a product review of the week, oftentimes health tech or a natural health-based product that I'm using in my practice or with my family. And then, of course, 2 research articles that you won't want to miss. So I also want to make sure you're on the cutting edge, that you are in the know. But before we get to those, we always like to do a little bit of a week in review. This week has been a big week. And I do have to say that if you're not a part of our newsletter, it's free to sign up. You can just go to stephencabral.com and you can just scroll to the bottom, input your name for the newsletter. However you want to get on it, you can get on it at stephencabral.com. But there are now over 250,000 people who read this on a weekly basis. We typically send you no more than 1 to 2 emails per week, things that we don't talk about necessarily on the podcast. My favorite products, I review them. Of course, there's no obligation to purchase any of them. News and events of what's going on. Just a couple times a week maximum. Of course, you can opt out at any time. I know nobody needs an extra email, but these are things that you won't want to miss. I love all of the different things that I want to share with you. And of course, I'm only able to do that in depth, really, with a picture and bullet points in a nice email format that I would want to read. Maybe you do as well. Check it out at stephencabral.com. All right, podcast recap for the week. Hopefully you didn't miss any shows, but they are all available at stephencabral.com/podcast. This week, we kicked off the week with the top regrets at the end of life. Now, I don't want it to be a somber or downtrodden-based show, but I wanted to share with you, if we already can think 10, 20, 30, 50 years down the road, then we can begin to live a life on purpose, right? We can begin to say, if these are the majority of regrets that most people have, what if I could think about those things now so that I too don't have those regrets? Definitely want to check out that show. That was a big one. That was Monday. Tuesday's show was fluoride's hidden side effects. So the dental medical establishment would love you to believe that fluoride is the absolute best thing for your teeth. However, that is simply not the case, and I share with you 10 hidden dangers of fluoride that you'll want to know about. All right, number on Wednesday's show was, are environmental obesogens making you gain weight? Super important because, again, the whole world would love you to believe that if you just eat less and exercise more, all the weight will fall off. Well, that might be true, but you might have to drop down to 800 calories in order to make that happen. And that is not a very fulfilling life, eating 800 calories and doing an hour or more of cardio per day. Don't fall for that. There is so much more to the body transformation game. We'll call it a game because you need to figure out the puzzle in order to achieve it for yourself. And I've been doing this since 1996. It doesn't mean that I'm the best at it in any of those things. It's just, I hope by now, after almost 30 years, 29 years, that I figured out a thing or two about a thing or two, and environmental obesogens are one of those factors. All right. Yesterday's show was how to protect and brighten your eyes as you age. This is one that I'm concerned about because, like many people, I stare at a computer screen for way too long every single day. How do we protect our eyes and our eyesight as we get older? Check out that show. All right, let's dive into our product review of the week. This is one that hits home. I don't think it's embarrassing because these are all natural things that we all deal with in life. However, let's just say a family member has not exactly athlete's foot, but they do have a yeast-based infection on one of their feet. And so I said, no problem. Let's go through how we can do this from a natural-based perspective. And so what does a yeast-based infection look like in your feet? Well, athlete's foot would be burning or itchiness or irritation between your toes. But you can actually get the yeast fungal-based infection anywhere on your foot. And it could look like cracking, or it could look like peeling skin, or it could even be sometimes raw, a little bit of flaking on the foot itself, and it can spread because it is a yeast, it is a fungus. So the first thing that we do is we actually use a foot bath. You can use baking soda and a little bit of Epsom salt. That's really nice for a foot soak. You could use even a little bit of ACV as a toner after the bath or even in the bath, your choice. So ozone in the bath, if possible, with a little baking soda, or if you only have baking soda, great. Foot bath, you'll do that each and every night. Great way to do it. I like the ozone with it. I can link up I think I can link it up, right? I can't provide, any medical advice, medical treatments, medical cures, medical diagnosis. I think I can link up an ozonator. I know I can't link up any products like the CBO protocol that can help with candida-based and gut-based issues, but I can link up, I think, the ozonator. So I'll try to do that at stephencabral.com/3346. And if you can't find it because we couldn't link it up due to FDA and FTC regulations, you'll find everything at stephencabral.com/shop. Just takes you over to our virtual functional medicine practice where you can find all of these different things. You can just search in the search box. Okay, so that's step one. Step two, I want to share with you product. No affiliation to this company. It's called Puriya, and it is the best balm that I've found to date. Now, maybe I give a recommendation in the future that's different. However, never makes this one bad unless they change the formula. So this one, inside of it has zinc undecillinate. That undecillinate, again, even with zinc, very powerful antifungal. We actually have, and we use undecillic acid. It sounds like acid. I know it sounds like a bad thing, but it's just a byproduct ours is an extract typically from coconut. Amazing product. And we use that internally from coconut extract for yeast fungus as well. All right, what else does this one have besides the zinc undecillinate? It has tea tree. We know that tea tree kills fungus. Amazing product to use externally. Even if you want to do 2-3 drops in a little bit of coconut oil, you can make your own. But again, it's kind of the same thing as buying this product as well. And what else does it have? Coconut, of course, right? Caprylic acid in there, avocado, lavender, rosemary, another amazing antifungal. We use that in our mold protocol as well as our CBO, geranium, and 9 other plants. So natural, great product, helps with any type of fungal-based itch. Maybe there's a fungal-based overgrowth groin-wise, right? Sometimes they call that jock itch, or maybe it's on the feet. This is a product that you can use and then put your socks right on if you wear socks. Now, for this family member, so this is very simple. I'll open this up if you're watching this on video. And if you're watching on YouTube, we appreciate you being a part of the YouTube community. We recently passed 100,000 subscribers, so thank you so much for following along. Small little jar, little dab will do ya, as they say, literally half a teaspoon, rub it in, use a liberal-based amount, and then you can put your socks on, or you can just let it dry and then rub off the excess, let it dry for at least 5 to 10 minutes. So I'm having this individual put it on in the morning, put their socks based on, and then they can do it after their foot soak at night. This works really well. Just letting you know that typically takes 3 to 4 weeks, and you'll see it start to dry up. New pink skin will begin to form, and really, really excellent. Now, a couple more tips. Change your socks. If you have sweaty feet, change your socks twice a day. That sweaty feet is a breeding ground for fungus. If you walk in a locker room, wear flip-flops, where oftentimes this is spread. And the last one, don't wear socks to bed. Let those feet air out, right? So put this lotion on, let it dry for a bit, and then you can hop into bed. But let those feet air out. Whenever you're home, whenever you can, take the socks off, let the feet air out. All right, that was our product review of the week. I can link this up, I think. If I can't, again, you'll be able to find it on Amazon, which is called Puriya, 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 antifungal balm. Again, no affiliation with the company. I like to promote great companies doing great work. That's what it's all about. All right. I actually wanted to bring you a second product review this week. So instead of a quick tip, instead of a book review, I was away last week with my daughters on their spring break. I got to read lots of books. Amazing. I want to bring those to you soon. However, what I want to do is share with you, because I said there's a lot of hidden potential side effects and dangers to using fluoride. So then the next natural question is, well, what's a good toothpaste to use? And it's funny because ordinarily I would never know this and really thinking about this. And not too much, honestly. My wife is amazing at handling all these different things. But our family, there's 4 individuals in my immediate family, and we all use a different toothpaste. I know that that's crazy. I know that that sounds crazy, but I'll tell you why. Toothpaste has a taste to it. It is somewhat subjective, texture-wise and not. So I won't tell you who uses what, but in my family, we literally use the Himalayan natural toothpaste by Himalaya. One of us uses Boca, another one uses Risewell, and another one uses Wellness. So all great toothpaste, all great fluoride-free. Some are a thinner consistency, which I don't like, and some are a thicker consistency. No carrageenan, of course, that's one of our, we don't use carrageenan, we don't use fluoride. We like some of the hydroxyapatite and some of the minerals added. Baking soda is one of my favorites to have in there. I also like neem and other things as well. Not all of them have those things. That's the ones that I choose to use. But just letting you know, those are 4 great brands. And again, at least as of today's recording, all clean ingredients. Again, toothpaste is subjective. I link up a few of my favorites at stephencabral.com/resources. And if we can link to these on Amazon, we'll link to them on Amazon as well at stephencabral.com/3346. But I wanted to share with you, my family, my 2 daughters, my wife, myself, all use a different toothpaste, which is kind of funny. So on vacation, we had 4 different tubes of toothpaste. All right. Luckily, most of them have travel ones as well, so they're very small. 2 research studies for the week. The first one's a little intense, not going to lie to you, but it's very important for someone out there. So if you know someone dealing with lung cancer, unfortunately, there are many people out there dealing with cancer, and I told you that I'm not going to let up on this. I'm going to bring you the best of the best in terms of conventional medicine and natural medicine. If someone has lung cancer, I would be using all of the best resources at my disposal. I would be following the the protocols I have at stephencabral.com/cancer. They are not Equalife products. They are not anything like that. This is specific natural healing modalities, not providing any medical advice, medical treatment plans, medical cures, medical diagnosis, but these are things verified by legitimate PubMed science. They work. They're great. Okay. But also, I'm not going to overlook, because we're talking about life-saving. We're not talking about high cholesterol. We're not talking about high blood pressure. We're not talking about type 2 diabetes, right? All of those things are reversible. And most, unless you have super high super high blood pressure, are not immediate dangers, right? But of course, always listen to your doctor. But cancer is, especially lung cancer. So having said that, there is a new pharmaceutical that holds a lot of promise in a specific type of lung cancer. Okay. The short of it is this, and I will always link up the research. This is by Dr. Timothy Burns, Associate Professor of Medicine at the University of Pittsburgh. And this was published in the Journal of Clinical Oncology. All right. So here's what it says. ALK positive lung cancer. ALK means anaplastic lymphoma kinase. That's ALK. All right. It's a type of non-small cell lung cancer. All right. They found that a specific pharmaceutical called lorlatinib, also sometimes I believe called Lorbina, the cancer progressed for only 40% of the patients taking the newer pharmaceutical loratinib or Lobrina for 5 years versus 92% of patients taking the previous first-line drug called Xalkori. Now, they got double the results. That is an amazing breakthrough. So that's why I had to share it with you. Meaning only 40% of people taking this particular pharmaceutical, it progressed. But the previous one, 92% did. That's not a great stat, right? So in this one specifically, I pulled out the research. All right. Let's see. It has been shown to inhibit a wide range of ALK resistance mutations. Remember, ALK stands for anaplastic lymphoma kinase, or anaplastic. In a case report, a patient with unresectable, and that means they could not surgically remove the non-small lung cancer, they had complete remission. Amazing. Another study was associated with 12-month cumulative incidence of central nervous system progression compared to the previous drug in patients with or without brain metastasis, because so many people with this particular type of lung cancer also had brain metastasis. It indicates that this particular pharmaceutical has robust intracranial activity and can improve progression-free survival in patients with previously untreatable ALK-positive NSCLC, which stands for non-small cell lung cancer. All right. So in summary, loratinib demonstrates significant efficacy and tolerability in treating ALK positive and ROS1 rearranged NSCLC, which just basically stands for that type of lung cancer. So if you know someone with lung cancer, direct them to this podcast. It may just double their chances of survival, which is pretty amazing. or decrease half the risk if you want to look at it that way. All right. So that was an intense one. We're going to end with an easy one. All right. I know so many people right now dealing with borderline high blood pressure or high blood pressure. Best thing that you can do is buy an Omron automatic blood pressure cuff from Amazon or your favorite functional medicine practitioner. My favorite one is at stephencabral.com/resources. And what you want to do though is take your blood pressure in the morning and most importantly, before bed. You want to look for a reading below 120/80. Ideally, it's like 110/70, right? Right around there. So the goal though is to get an accurate reading. Too many people I know, they've heard, okay, I'm supposed to keep my arm at heart level. So they hold their arm up in the air. Going to give you a higher result. Okay, here's what I want you to do. Find a table that is slightly lower than heart height. And then you're going to rest it on the table with your palm facing up. Then you're going to take the cord from the blood pressure cuff, run it through your middle and ring finger, and allow it to come straight up your arm. And the cuff will go about 2 fingers above the crease of the elbow, right along that brachial artery. And that cord faces up on the arm. That is how you're going to get the most accurate reading. I've literally been to clinics when I was younger, all of that, and they just put the cuff on willy-nilly, whatever. I mean, I was young, all of that. But like, that's not how you take blood pressure, right? So you want to get an accurate reading because literally your life depends on it, right? You want a healthy blood pressure because if your reading is 135, 140, 150, over 85, 90, 100, that's a signal that you need to start working on lowering your blood pressure, right? Okay, so that's how to do it the right way. I've got a lot of podcasts on blood pressure, but I wanted to direct you that if you're dealing with borderline high blood pressure or high blood pressure, please do check out the free podcast at stephencabral.com/3322. That's stephencabral.com/3322. That is it. And that is going to be it for today. Hopefully this was helpful. All the links today at stephencabral.com/3346. Have an amazing rest of the day. As always, do feel free to share the show with anyone you believe it could serve. Take care, everybody. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.